60 seconds guess the diagnosis, and as always, answer at the end. Let's go. Kimberly is 35 years old. She's been experiencing some strange symptoms over the last couple of months. She initially noticed that her chin was slightly numb. There was also a prickly, tingling sensation. She visited the dentist to make sure there wasn't a problem with her teeth or gums. After getting the all clear from the dentist, he advised her to visit her GP. Her GP did routine blood tests. The full blood count, liver, kidney function, as well as the electrolyte or salt levels were all normal. There was no clear cause noted. Over the next couple of weeks, these symptoms come and go. It's only when she starts to notice numbness and tingling in the hands, and also some slight discoordination, particularly when she's texting or using the TV remote, that she goes to A&E. The A&E physicians notice that the symptoms are worse and profound on the right-hand side. They're initially concerned of a stroke. A CT head is done, which is normal, which is then followed up by an MRI scan, which again is normal. As these symptoms settle over the next couple of days, she's discharged home. A few weeks following this, she then starts to develop some visual symptoms. She visits the optician and the backs of the eyes look fairly normal. There's slight concern that there might be a build-up of pressure in the back of the eyes, so again she's sent to a local A&E. Here, it's picked up that she was previously diagnosed with breast malignancy. She completed all of her treatment for her early breast cancer 6 years ago, and she feels that she was given the all clear about a year ago. These weird symptoms are then presented to the oncologist, who then see her in the clinic. At this point, she's now getting numbness and tingling in the hands. The bowels and bladder are not quite right. She gets some weird visual symptoms, and this numb chin comes and goes. If I tell you this is a fairly rare diagnosis, it occurs in approximately 5% of patients with a solid organ malignancy. It's quite tricky to diagnose. An MRI scan of the brain and spine can pick up roughly 6 out of 10 cases. A lumbar puncture, a small needle into the back to collect the fluid that surrounds the brain, can pick up approximately 7 out of 10 cases. Again, no test is perfect. If I tell you this is because of her malignancy, it's now spread to the central nervous system. It's not actually in the brain, so it's not a brain metastasis, but the tumour cells have invaded the fluid that surrounds the brain, or the meninges, which are the cling film lining that surround the brain too. If I tell you because these tumour cells can be floating around causing problems, it can cause to transient and a vast array of neurological symptoms. The patient looks at you and says, "Doc, what do you think's going on?" Correct, this is leptomeningeal carcinomatosis.